Hello everyone. So in this video I am going to talk about the hydrocephalus. Okay, hydrocephalus generally it is a congenital deformity, or we can say it is sometimes acquired also. So what is hydrocephalus? So it is excessive fluid accumulation in brain. Okay, that means CSF. Okay, so excessive CSF accumulation occur into the brain. That condition known as a hydrocephalus, which caused due to two reasons. First is lack of absorption of CSF, and second that is due to blockage. Now we talk about the CSF normal flow कितना होता है. Okay, CSF normal flow. So it is up to 120 to 150 ml. It is general normal flow. नाउ CSF प्रोडक्शन होके कहाँ से कहा जाता है, तो हम उसके वे की बात करेंगे. CSF वे. So generally it secrete into the choroid plexus, secrete from choroid plexus. Okay, so what is choroid plexus? It is a network of capillaries, from choroid plexus it go into the two lateral ventricles. Then from two lateral ventricles it go into the third ventricle. Okay, third ventricle by a interventricle foramen. Okay, by interventricle foramen go into the third ventricle. This interventricle foramen also known as foramen Monro. Okay, now from third ventricle it goes into the fourth ventricle. Okay, a fourth ventricle માં જશે by a cerebral aqueduct, or we can say it is a aqueduct of Sylvius. Okay, from third ventricle by a cerebral aqueduct it go into the fourth ventricle. A fourth ventricle में से ये थ्री स्ट्रक्चर में जाता है. One is central canal, second is lateral aperture, and third is medial aperture. Okay, lateral aperture also known as foramen Luschka, and medial aperture we also known as foramen Magendie. Okay, so it is a CSF wave. From it secrete into the choroid plexus, that known as network of capillaries, go into the two lateral ventricles, then into the third ventricle by a interventricular foramen, then in fourth ventricle by a cerebral aqueduct, or we can say it is aqueduct of Sylvius. From there it go into the three structures: central canal, lateral aperture that is foramen Luschka, and medial aperture that is foramen Magendie. Then it go into the subarachnoid space. फिर ये तीनों में से जाएगा subarachnoid space में. Then go into the subarachnoid villi, and lastly it is absorbed into blood. Absorbed in blood. So this is a normal CSF way. Okay, now we talk about the causes of hydrocephalus. Okay, so there are two causes. First is congenital and second is acquired. Congenital में हम बात करेंगे तो फर्स्ट कॉज दैट इज मैटरनल इन्फेक्शन. ओके, दैट इज torch, which is most common. Then second that is any congenital tumor, and third that is brain malformation. Okay, 1, 2 and 3. So these three reasons are congenital causes of hydrocephalus. In brain malformation, three conditions. First is Arnold-Chiari, second is Dandy-Walker syndrome, and third, that is stenosis of cerebral aqueduct. Okay, so Arnold-Chiari, that means herniation of cerebellum in spinal canal. Okay, इसमें क्या होता है, जो हर्निएशन होता है सेरेबेलम का स्पाइनल कैनाल में थ्रू फोरामेन मैग्नम. ओके, सो ड्यू टू दैट द CSF जो है उसका क्या होता है, CSF का ब्लॉकेज होता है. सो दैट कॉज नॉन कम्युनिकेटिंग हाइड्रोसेफेलस. जनरली जो हाइड्रोसेफेलस है उसके दो टाइप है उसके. वन इज नॉन कम्युनिकेटिंग एंड अदर इज कम्युनिकेटिंग. वी सी इट फर्दर. ओके, सो जस्ट रिमेंबर, ड्यू टू ब्लॉकेज द नॉन कम्युनिकेटिंग हाइड्रोसेफेलस इज occur in Arnold-Chiari. Then Dandy-Walker syndrome. In that, cyst formation occur in fourth ventricle. Okay, सो ड्यू टू दैट क्या होगा, जो फोरामेन ऑफ लश्का है वो नैरो हो जाएगा. सो दैट ऑल्सो कोज अ ब्लॉकेज. ओके, सो इट ऑल्सो प्रोड्यूस नॉन कम्युनिकेटिंग हाइड्रोसेफेलस. द लास्ट दैट इज स्टेनोसिस ऑफ सेरेब्रल एक्विडक्ट. ओके, सो स्टेनोसिस मीन्स क्या हो जाएगा, ये नॉर्मल है जैसे कि सेरेब्रल एक्विडक्ट. स्टेनोसिस होगा अगर तो इस तरह का हो जाएगा. दैट मीन्स नैरोइंग हो जाएगा, नैरोइंग ऑफ cerebral aqueduct, which also cause blockage. Okay, और increase हो जाएगा ICP. So that also produce non-communicating hydrocephalus. So these are the congenital reasons of hydrocephalus. Now we talk about the acquired. So acquired is, first is encephalitis, second that is any meningitis भी different types के होते हैं, viral meningitis, bacterial meningitis. Okay, so meningitis. Third is brain tumor. Okay, most common brain tumor, that is medulla blastoma. And fourth reason, that is birth injuries. Okay, so these four acquired causes for the hydrocephalus condition. So in next video we talk about the sign and symptoms, the diagnosis and the management. Okay, thank you.